Assalamu alaikum. In this video, we will continue the third chapter of Therapeutic Exercise Foundation and Techniques book, 7th edition, as you have seen the picture in video's thumbnail. Chapter 3 is about range of motion. In the last video, we have discussed how to perform the range of motion techniques on patients for upper extremity and for cervical spine. But in this video, we will discuss how to perform range of motion techniques on the patients in detail by focusing on the lower limb and on lumbar spine. So starting from the lower extremity, and in lower extremity, we will start from the hip joint because it provides wide variety of range of motion techniques. So first of all, the hip comes, and for hip the first range of motion technique that comes is combined hip and knee flexion and extension. This slide is showing two parts, A and B. A is showing initiating combined hip and knee flexion, and B is showing completing combined hip and knee flexion. Hand placement and the procedure is shown in the pictures. After this, the next range of motion technique that comes for hip is hip extension, that is also the hip's hyperextension. This is how to perform the hip extension with the patient sideline. After this, the third range of motion technique that comes for hip is elongation of two joint hamstring muscle group and elongation of two joint rectus femoris muscle. So the range of motion, how to perform range of motion technique for the elongation of two joint hamstring muscle group is seen in this picture, can be seen in this picture, but how to perform the two joint rectus femoris muscle is by positioning the patient supine with the knee flexed over the edge of the treatment table. There is one very important thing for performing elongation of two joint hamstring muscle group, that if the hamstrings are so tight as to limit the knee from going into extension, the available range of the muscle is reached simply by extending the knee as far as the muscle allows and not by moving the hip. After this, the next range of motion technique comes is abduction and adduction. Abduction is simply performed by moving the leg away from the other leg, and adduction is performed by moving the leg towards the other leg. After hips abduction and adduction, hips medial and lateral rotation comes. Medial rotation is performed by internally rotating the leg in flexion, and lateral rotation is performed by externally rotating the leg in flexion. These were all the range of motion techniques for the hip. After hip, ankle joint comes. Ankle joint offers two main range of motion techniques. First is dorsiflexion, second is plantar flexion. This is how the dorsiflexion is performed. Hand placement is clearly shown in this picture. After that, we come towards plantar flexion. Plantar flexion is performed by supporting the heel with the bottom hand and place the top hand on the dorsum of the foot and push it into plantar flexion. If the patients are bed bound, the ankle tends to assume a plantar flex position from the weight of the blankets and already by the pull of gravity, so this motion may not need to be performed by the therapist. After ankle, the lower ankle comes and it offers two major range of motion techniques. So the subtalar joint offers inversion and eversion. Inversion is performed by moving the joint in inward direction, or eversion is performed by moving the joint in outward direction. After the subtalar joint, the joints of toes comes, and the joints of toes offers four major range of motion techniques: flexion, extension, abduction and adduction of the metatarsophalangeal and interphalangeal joints one by one. This is the hand placement, and this is how the procedure can be performed. These were all the range of motion techniques for the lower extremity, hip, ankle, lower ankle, and for the toes. Then the lumbar spine comes. Lumbar spine offers three main range of motion techniques: flexion, extension, and rotation. First of all, the flexion comes. Flexion of the lumbar spine is achieved by bringing the patient's hips into flexion until the pelvis rotates posteriorly. In this position, performing this range of motion, the patient is in spine, but to perform the extension of the lumbar spine, the patient position the patient in prone, place the hands under the thighs and then lift the thighs. In this way, the lumbar spine's extension can be performed. After that, in the last, rotation of lumbar spine comes. Rotation of the lumbar spine results when the thorax is stabilized and the pelvis lifts off the table as far as it is allowed. So these were the three main range of motion techniques for the lumbar spine. After that, there is one very important clinical tip how to perform while performing the range of motion techniques on the upper limb, either on the lower limb. That effective and efficient range of motion can be obtained by combining several joint motions that may transact several planes, resulting in oblique or in functional in diagonal patterns. For example, wrist flexion may be combined with ulnar deviation, or shoulder flexion may be combined with abduction and lateral rotation. So this lecture was all about the range of motion techniques on lower extremity and on lumbar spine. The next upcoming lecture will be about continuous passive motion. This is that will be also from the chapter 3 of this book. So more lectures from this book and from this chapter and from this channel. Stay tuned to our channel and do subscribe the channel Physiotherapy Lectures at YouTube.